who's a podiatrist. Now, Dr. Monday, I was watching an episode a while back of The Doctors, and they mentioned that black tea is really good for foot odor. Now, do you recommend natural cures for foot-related diseases, or do you feel that the allopathic route is always the way to go?
No, natural cures are definitely, I like to start there. I like for especially a lot of the older patients, because they come in and if they've had any type of swelling, Epsom salt is always one of the #1 things that they will try. Epsom salt soaks. I definitely sweet tea soaks for the foot problems, powders, but in some cases, well, a lot of cases, we're kind of regulated by the FDA on what they approve too, because if we get too much off the track and something happens, then we're held liable for it while we didn't try the medicine that, that has been proven through research to work.
Yeah, and that's unfortunate.
Yes.
And I also read too that when a child has a fever, that you can soak 2 cloths in egg white, because the egg white has albumin in it, and you place the egg whites underneath the bottom of the child's feet, and it's supposed to draw the fever out through their feet. Now, I tried it with my daughter, and it worked. In less than an hour, her fever went from 102 degrees to 99 degrees. Now, what is it about the feet that make them such a great absorption point?
I'm not for sure why the albumin works on, from the egg whites, but I will definitely try that. But I can tell you, because of the sole of the feet and the skin, it's just like under the pits of your arm, we have so many sweat glands underneath there, which is why people sweat more underneath the bottom of their feet. Their socks are usually sweaty, and so that makes a huge area for absorption.
Gotcha, yeah, because I remember seeing somewhere that 2 to 5 million sweat glands, of the 2 to 5 million sweat glands that we have throughout our body, something like 500,000 of them reside underneath the bottom of the feet. Is that true?
Yes, ma'am. It's same with the soles of the hands.
Oh, okay. Now, and another thing too, I keep seeing these commercials promoting the foot detox pads. Now, I've never purchased any of those foot detox pads because I heard that they didn't work. But I have gone in and I've gotten an ionic foot bath. Now, I didn't experience some of the the miracles that I've heard other people talking about, but I did have some of the best sleep of my life that night. Now, it could have been the placebo effect, I don't know, but I do know that it was great. Now, is a foot detox something you would get for yourself?
Definitely not. It's mostly the power of suggestion. You tell someone something is going to work, and you change the color of the water, and all of a sudden all of the impurities are washed out of their bodies.
So the infomercials that we're seeing, don't buy the foot pads.
No, don't buy the foot pads.
Because I know someone that bought it, and they swore the next day it changed colors, and they said, well, my legend shows that if this foot detox pad turns this color, then it clears this organ.
Oh, I've heard it all.
Now, what about all the new, do you get regular pedicures?
No, not in particular for myself, only because I see so many infections with them. So I'm not a huge promoter on pedicures, but I can tell you some suggestions if you are one of those people that like to have a lot of pedicures performed. Well,
because I know that in the news a couple of months ago they were talking about this new pedicure. It's like a flesh-eating. They use flesh-eating fish to give the pedicure. Now, apparently, the fish is supposed to eat the dead skin off of the feet, but they don't touch the healthy skin on the feet. Now, advocates say that this is a natural alternative to the potential unsanitary razors. Now, could I walk by a nail salon one day and see you in there getting a flesh-eating fish pedicure?
Probably not. It kind of scares me. It's like piranhas. No, probably not. Only, usually a nice file without having to put any medicine on your feet. If you file your feet before or after you get out of the shower, so if you have any areas where you have any corner calluses, that usually takes care of the problem yourself. And you can do it in the safety of your own home, and nice sanitary. Make sure your instruments are nice and clean, and you don't have to worry about the flesh-eating fish.
Yeah, I thought that was interesting.
That was very interesting. I haven't heard that before.
Yeah, the little fish, you should see them, they're floating around in the water and they're nibbling at your feet and they're supposed to gnaw off all the raw, the dead skin.
It's funny, we have a meiosis where we use maggot therapy to briden wounds, so it's sort of kind of similar, natural technique, and it works beautifully because they only eat the bad flesh, so you put them on a wound that's not necessarily viable, and all of a sudden they eat off the bad tissue and only leave the good tissue there.
Now, I wonder who thought to feed dead skin to a fish.
Who wouldn't let the fish nibble on their feet in the beginning?
Yeah, I mean, I thought that was hilarious, and I know there's a salon in Virginia that's actually doing that. I saw the pictures, and it's like the fish, they're smaller than like the little minnow fish. They're super small, and they're just running around chomping at the feet. I thought that was interesting. I thought it was hilarious.
It kind of freaks me out.
Now, and you mentioned tips. You said you would give tips to people who are interested in getting pedicures. So what kind of tips do you have for us?
Definitely. Number one would be make sure the nails are just cut straight across. It shouldn't be dug into the skin. A lot of times what the pedicurist does is he removes your cuticle, which is the seal around the nail, and a lot of times from that we get a lot of the what we call onychomycosis, or nail fungus, and so people come in and wonder why their nail is starting to turn black, and it's usually after between 10 to 15 days after the pedicure, because they remove that seal and the fungus has got underneath the nail plate and caused a nice little fungal infection.
So when they're doing a pedicure and a manicure, they're not supposed to cut the cuticles?
No, and a lot of times they remove those cuticles, but the cuticles there, and they have a purpose, and when they remove those cuticles, it opens you up for an infection.
Wow. Any other tips?
Also, I would definitely take my own nail polish to the salon. If you notice, most people pick out the nice little pretty red colors, and so if you have, and that's another way that the fungus can be spread from person to person, because you got to think how many other people that you don't know have used that same polish and dipped out of that same polish. And so if you have your own polish, even your own tools, and take them with you and make sure they're nice and sterilized, then that will prevent a lot of infections.
Now, I would have never thought that. I mean, one time I took my own polish in, but simply because I wanted to use that color because I had that color on my toes, but I wasn't even thinking about it. But that makes sense, though. That makes sense, because the skin is alive, and I guess if they're using it on everybody else, it could transfer different bacteria and fungus.
You're absolutely right.
Wow. Okay. Well, that's a nice tidbit of information. Now, switching gears a little bit, there's been a long-standing debate about how running barefoot is better than running with shoes. And there was even a book written on barefoot running called Born to Run by Christopher McDougall. Now, with you having been on both sides of the table, you were a successful athlete who was one of the lead scorers at Augusta State University's women's basketball team. And on the other side, you're a practicing podiatrist and a podiatric surgeon. Now, having been on both sides of the table, would you say it's better to run barefoot or run with shoes?
Interesting question. Right now I'm still more in the running with shoes. I can tell you I've started with Reebok has come out with a line that has the flexible shoes that supposedly mimics running barefoot now, and a lot of shoes are following that same trend. Because of that, I would say if you have more of a normal foot type, meaning you don't have excessively high or low arches, that would be something that may feel comfortable for you. But if you have a foot that needs support, meaning that it is an extra high or low arch, then I would definitely recommend the shoes with some type of insert inside the shoe to give you the support you need, because running in itself can be very traumatic to the foot. They also did a huge study on the Kenyans and how they would run, saying that they would actually, instead of doing the heel to toe, they would run in toe to heel, and which caused a lot of people to start trying to mimic their running techniques and running from toe to heel, which caused a lot of pathologies in their foot, a lot of traumas in their foot, and stress fractures, because we're just not used to running that way because we wear shoes here most of the time. Yeah,
I mean, those Kenyans could run. Every year for the Peachtree race, usually it's a Kenyan. It's a Kenyan that wins. There's a certain technique to running. Now, go more in detail about that. Explain that for me.
Well, there's a gait cycle, and usually there's different path through the gait cycle, but basically you go heel to toe. There's a stance phase also, but basically you go heel and finally
Can you do it with one of the feet there?
Yeah, so usually when you're walking, your heel strikes the ground first, and you go to your stance phase, and then you go to toe out phase. If at any point in this phase, if you have a high arch or a lower arch, then the tendons that are supporting the arch has to work harder, so you need something inside the shoe, like a nice little orthotic, that helps support the arch. So during that phase, it's basically supporting those tendons, so your foot is not having to work as hard.
Oh, okay. So how do you know if you have, what type of arch you have?
Usually the best way to tell is what we call a subtalar joint neutral, so you need to be in a standing phase. If you ever notice when you go to a podiatrist, we always make you stand when we take your x-rays, as opposed if you go into the emergency room or see a primary care doctor, usually they put you on the table and put your foot down and just take the films, but you don't get a true representation of the foot until you have it in stance phase, meaning that you're fully weight bearing or standing up on it. It's a little bit more involved, but the main thing is make sure that you're bearing weight. And if your arches, if you're able to move your finger underneath your arch when you're standing, you probably have a normal arch. If your arch completely deforms or your foot swings out when you're walking, you probably have a low arch, or what we call pes planus, and a pronator. If your arch is, when you touch the ground, if you're able to put 2 or more fingers underneath the arch, probably have what we call a pes cavus, which is a high arch foot type, and you are a supinator at that point.
Now, is there a way, can you change your arch, or are you just, you know, born with a certain arch and that's your arch for life?
Well, I can tell you, most people are born with the arch they're going to have. For children, if they come in, or even adults, if you're having a lot of problems and it can't be corrected with putting inserts inside of your shoes, meaning it's a stiff condition, then we can definitely take you to surgery, and we have to change the structure of the bones in order to change the way the foot function or the way the foot appears, the foot structure.
Well, no, what about because I noticed you have a foot insert there. Now, I see foot inserts at Walmart for $2. Then the guy who sits in front of me at work, he paid $250 for one. What's the best insert for your feet?
So custom made is the best orthotic, and what happens is you go into an office and they make your a mold of your foot, and they should have you in your foot in a certain position, what we call subtalar joint neutral. That's the way your foot should function. And then we build an arch inside of the orthotic, so it makes you function the way you should. The main thing to look for, a lot of times you go in the stores and those inserts are really soft and malleable, like the end of this orthotic here, and you can fold it with your hands. So you can imagine if you're able to move it with your hands, and I don't think any of us is Lou Ferrigno, when you put it in your shoe, it's not really controlling anything, it's just a cushion. Cushion in itself doesn't change anything, it just provides, if you have a deformity like a huge spur, or older people who have diminished fat pads, they'll put inserts inside their shoes and it's comfortable. But for someone young like yourself or me who wants to get out and become active and who is having foot problems, you want something that has a solid insert and that's going to support your arch. So basically it takes the stress off the tendons that when they're working.
So what about when I go out and I want to be cute and I want to wear my 4-inch heels? What's a good insert that's going to protect this part? Because that's the part that seems like it wears out or it hurts after a while.
But I can tell you, for those getting the little gel and the little pads to put underneath the metatarsal heads are great. Anything above a 2-inch heel or orthotic is not going to work in at all. So at this point, you're strictly going off something that's for cushion. So getting your nice little gelling pad and just sticking it in the bottom of your shoe, because you got to think as your heel goes up in the shoe, it puts a lot of pressure underneath the ball of your foot. And so you just need a little support while you're wearing that heel. And I probably wouldn't wear it every day.
Wow.
But for one night, that would at least help you.
Yeah, because I wear heels a lot. And I remember when I first announced to the church that I was pregnant, they had this intervention, so to speak, because I was still wearing heels. And they were like, no, you cannot wear heels. And, you know, you're pregnant. Now, is there a parallel there? I mean, if you're, should you not? You mentioned something about wearing them every now and then. Now, what will happen if you continuously wear heels on a daily basis?
One of the things, the biggest thing that happens with heel is the shortening of the heel cord, which is this nice little tendon here in the back, the Achilles tendon. The Achilles stops your heel from slapping the ground every time you walk. some of the pathologies that can occur, the problems that can occur when your heel cord shortens, is that when you become a toe walker, putting more stress, and you'll notice that you get calluses underneath the bottom of your foot. Your toes can start curling there. And the main thing, your arch can also get lower, and it can cause bunions too, wearing those type of shoes.
Now, and I hear a lot about Achilles tendon for football injuries. You hear it on TV all the time. Now, what is the Achilles tendon, and what is it for? What does it do?
So the Achilles, you probably heard of the Greek god Achilles. It's the major tendon. It's the strongest tendon in the body, and what it does is supports you when you're walking, so it stops you when you're walking from your heel from slapping the ground. So when you push off the nice little Achilles, which is this tendon here in the back that inserts there, it stops your heel from slapping the ground. So when you injure it or rip it, you basically have no propulsion anymore. So like I ruptured mine 2 years ago. I had to have surgery while I was playing basketball. It's usually a sports-related injury or some type of major push-off that causes it. Usually tennis or basketball and or football can cause injury.